All right, we're going to try this again. If anybody can see or hear me, let me know. I'm just going to get right into it because I've got a lot to talk about. I've had a lot on my heart and mind for a while now, and I'm going to speak up about it. I'm not going to get to it all today, so hopefully there will be more videos to come, Lord willing. So there's a lot to cover. I'm not even going to get the tip of the iceberg. And I'm probably going to take some heat for this, but that's okay because there's stuff that needs to be discussed. I'm pretty bold about the things that I post, but I don't think people are seeing or receiving my posts. So there are people who need to hear this message. So here we go. First of all, who am I? I am a mom. I'm a wife. I'm not a doctor. I'm a family nurse practitioner. I hold 2 degrees in science and nursing. I graduated with highest honors, hi Shauna, and a 4.0 GPA with my master's degree, so I took my studies really seriously, but I don't want you to take anything that I say blindly. I want you to look into it for yourself, okay? But I do want to warn you that when you do look into this stuff, you need to consider your sources, be aware of any conflicts of interest, and make sure that those conflicts of interest are fully disclosed, okay? So I need to mention to you that it's never my goal or my intention to offend anybody, okay? But it is my goal and my intention to speak the truth, and I will do so unapologetically. So if the truth offends you, that's something that you probably need to do some self-examination and some self-reflection on and pray about it. Just because of the controversial nature of the content that I'm going to be discussing, I think debate is inevitable, and that's fine. I want to get you critically thinking. I want to challenge you. But along those lines, I have to address the haters because there's always some haters. So I'm a family nurse practitioner. In my line of work, I often deal with mentally ill patients and all sorts of behavior extremes that go with that. Angry patients, belligerent patients, explosive behaviors. So if you're a hater and you're going to spew hate on here, it's probably not going to faze me. I'm not really going to read it, or if I do see it, I'll delete it. So you're just sort of wasting your time. And I have Jesus, so if I'm being hated, then I'm probably doing something right. So the first people I want to address are the anti and ex-vaxxer parents. Now, I'm really not going to get into the meat and potatoes of the vaccine debate because we could be here for days and maybe even weeks, okay? But I am going to touch on it because it's really important. So the first thing I want to say to the ex-vaxxer or anti-vaxxer parents is that I commend you for being very courageous to take that stance in our healthcare system. It's a really difficult stance to take, and you're probably often bullied. And I want to let you know that even as a healthcare provider and having a formal education and like a decade in healthcare, I was still really intimidating when I had to have the talk with our pediatrician. So if you don't have a formal education, you're probably that much more vulnerable to what I'm going to call medical bullying. And that's going to be like an entirely separate live that I'm going to do another day on medical bullying, basically. So anyway, I commend you for being so courageous. But I need to give you some tips basically from the inside, okay? So if you're a parent and you've chosen to space out or not vaccinate your child or your children based solely on that maternal instinct or gut feeling or whatever you want to call it, I get it because I'm a mom. But unfortunately, in reality, when you're in the doctor's office, that doesn't really hold up, right? So you've got to arm yourself with knowledge. Knowledge is power. And I want you to know so much by the time that you have the talk with your pediatrician that you're really able to go into your pediatrician's office and school them, because they don't know what we know about vaccines, right? They didn't learn it in school. And I'll speak for myself. I did not learn about vaccines in school, and I'll get more into that later. In nursing school, we learned the vaccine schedule and how to give vaccines, what vaccines to give. You know, what is the schedule, when to give them, when not to give them, when certain vaccines are contraindicated. We learned about antibodies and active and passive immunity, but we did not learn about vaccine components. We did not learn about adjuvants. We did not learn the risks associated with vaccines. Not at all whatsoever, okay? So, you need to arm yourself with knowledge that when you get into that doctor's office, you're able to school them. I see a lot of this stuff about moms saying that they're in the hospital delivering their babies, and they're saying that I have to give Hep B, and I have to give vitamin K, and I have to do erythromycin eye ointment, and if I don't, they're going to call CPS. Hopefully by the time you're in the hospital, you've done some research. Obviously, I mean, you're having a baby, okay? This is not the time to be bullying anybody. So for the healthcare professionals there who are totally taking advantage of vulnerable moms, shame on you, first of all, okay? As long as that baby's coming out healthy and there's nothing emergent, Hep B does, I mean, we'll get into this another time. It's just, it doesn't need to happen, okay? Unless, of course, you know, mom is Hep B positive. There's always certain exceptions, but that is like, that's that. We're not even going to get into that because that's not usually what the case is. Okay, so anyway, you need to know, you need to be prepared when you go into the hospital, okay? Hopefully you haven't just started looking into this, and hopefully you have somebody there who's going to advocate for you, because you're having a baby. Otherwise, everybody, you need to know this. You need to be your own advocate and your child's advocate. If that is the only thing that comes across in tonight's message, good. You need to be your own advocate, okay? And then, you know, the threatening with CPS. They're telling me they're going to call CPS, blah, blah, blah. All right, you know what? If you know that you have nothing to hide, let them call CPS and then school CPS when CPS comes. I'm sure it's a horrific experience to have that happen to you with CPS. But if you've got the most basic important things, you're taking good care of your kids, you have a clean home, a healthy home, you're not doing drugs, and you're making sound decisions, educated decisions, then don't have anything to fear, okay? You have to realize who you're up against here. You've got to do your homework. I can't stress that enough, that knowledge is power. All right, another thing, when you go into your doctor's office, this new thing about crazy moms, okay? If you don't know the crazy moms thing, just look it up. You'll find it, #crazy moms. These poor mothers, I mean, of children that have been vaccine injured, they really are labeled as being crazy, and they've pretty much gone crazy because nobody's listening to them. And I get it, okay? Again, as a mom, I get it. But you have to be aware of how you're being perceived in your doctor's office. Again, I'm on your side, guys, okay? I'm on the inside trying to help you out. So don't be acting and looking crazy, because the doctors and the nurses and the MAs, they've probably already made their minds up about you. So if you're not going to be educated, because they are good parents, they are the ones who end up exactly, Shauna. But you just don't want to be, acting a fool in the doctor's office when you're already fighting this battle, to begin with. You basically don't want to give them ammunition, okay? All right. The next thing we need to talk about is if you are not going to vaccinate your children, and this is something that pro-vaxxers like to get on anti-vaxxers for, and I have to say, they're kind of right, guys. You've got to be boosting your children's natural immunity. You have to be feeding them healthy food. We're not going to get into that too much tonight. That will be a separate thing again. You've got to be feeding them healthy food. You've got to be hand washing. You've got to be breastfeeding. I mean, that's so important. And if you don't have a doctor that supports breastfeeding, run for the hills, okay? If your doctor doesn't support breastfeeding, something is seriously, seriously wrong, okay? All right, the next group of people that I want to address, the nurses. The nurses. I hope a lot of nurses are going to tune in, because I have a lot of nurses, friends that are nurses and coworkers, and I just want to give you some facts, okay? These are not really debatable. These are just plain facts. You can look them up for yourself. This is not my opinion. These are just facts. So the CDC schedule for immunization for pediatrics is not evidence-based. It's just not. It's just not. 2, 4, 6 months, all the vaccines that we see listed, it is not evidence-based. There's no study that says this is what's best to give to your children and safest at this time, okay? Not evidence-based, period, end of story. Okay, the next point is that vaccines are not tested against inert placebos. And going to nursing school, because of what we study in pharmacology, we sort of assume that because drugs are tested against placebos, like, of course vaccines are tested against placebos. Like, we would never inject anything into our kids that wasn't tested against a placebo for safety. Wrong. Again, another fact. Vaccines are not tested against inert placebos. Vaccine placebos are other vaccines or adjuvants, which are the very substances that we are questioning the safety of, okay? So, no inert placebos. Maybe that was something new that you didn't know before. Okay, the third point. When we give vaccines on the CDC schedule, they are not tested for compatibility or synergistic effects. So this might be relatable for a nurse who's working in the hospital. If you go to give multiple IV infusions, okay, you have lots of lines running, you're going to be piggybacking IV solutions or whatever. Nowadays, most people probably have some sort of system to run compatibility, okay? So we check, we plug it in, we type in the drugs, we make sure that they're compatible, that they're not going to have any horrible reactions to running both of these infusions at the same time. There is nothing like that for vaccines. We've never tested for compatibility of vaccines, okay? Another fact that's not debatable, it's not an opinion, they're just not tested for when we give all of these vaccines on the same day, okay? All right. What else do I want to tell you? All right. Well, I guess that's enough for now because we're going to get into a whole separate live on that. But if those things that I just shared with you, if that doesn't send up a red flag and you're a nurse, you are the one that has a screw loose, okay? Not the anti or ex-vaxxers. If you're a nurse and those things are not concerning and you're still willing to just go right ahead with the CDC vaccine schedule without looking into it, you need to check yourself, okay? Now, if you're not sure where you stand in the vaccine movement and you're a nurse, you need to go back and read this baby, okay? This is the Code of Ethics for Nurses with interpretive statements. You can get this for less than $20 on Amazon. You need to read it, you need to reread it, and maybe you need to read it again. You need to be really familiar with what this says. This will tell you what your role is in the anti-vaccine movement, or whatever you want to call it, okay? Another thing I want to say regarding healthcare professionals, in this movement is that it is downright disgusting for doctors to be discharging their patients from their practices for not vaccinating under the guise of protecting other children, okay? What's happening is I don't even know how many children that are going without a pediatrician because the parents have chosen not to vaccinate, and it should be a crime, okay? It's completely unethical. And if you're not sure, if you thought that doesn't seem right, here I am telling you, it's completely unethical. It's totally wrong, and it's disgusting to me. And this is what I do. This is what I do for a living, and it's disgusting to me that pediatricians are discharging their patients because the parents are choosing not to vaccinate. It's just harming the children. Exactly, Shauna, so many kids who need medical attention or something comes up and they do get sick. So that's horrible, and we'll get into that another time as well. That probably falls under the medical bullying that we'll get to in another live. So then the next group of people that I need to address are the Christians. So if you're a Christian and you're not aware of what's going on here and you're not awake to this, you need to wake up. For real, you just need to wake up. I would say that you need to pray for the Lord to prepare your heart and your mind for the truth, because you're just not looking. And if you look for this, if you investigate the truth, you cannot miss it. You can't miss this. It's in your face, you can't miss it. So you're just not looking, okay? But when you do see the truth, it's pretty earth-shattering, so you need to be prepared for it, okay? Some people will not allow kids if not vaccinated. So again, that goes by state. I don't know if I mentioned that. Vaccine laws are statutory, okay? So you need to know the laws for the state in which you live. And that's another thing for, especially for moms in hospitals delivering their babies that are feeling bullied, especially in that vulnerable condition, that they have to vaccinate. You need to know the laws for the state in which you live. So in the state where I live, we can have religious exemptions, so even if you can't get a medical exemption, you can get a religious exemption. And again, if you go on this journey and you learn about this, you will learn all about exemptions. Yes, Stephanie, yes, that's correct. That's correct, which is why you have to be educated about this, and you have to do it yourself. You have to be your own advocate. You have to educate yourself. All right, so it's probably going to be the moms who make the difference here. I'd love to think that it's going to be the noble, brilliant scientists and healthcare professionals that are going to make the difference here, but it's not probably. It's probably going to be the moms, because nothing drives us like our kids. Nothing. And for most of us, most parents with this stance have learned the hard way. And it's our hope that more parents don't have to learn the hard way. And if you're a pro-vaxxer and you just really hate on anti-nex-vaxxers, it's out of ignorance. Like, you just haven't looked. You haven't done the research. You haven't. So I would encourage you to please do it. Coming from a nurse, I know both sides of this. I'm a mom and I'm a family nurse practitioner, so I get it. I get both sides. And this is just the truth.